Hello everybody, my name is Stephanie Martinez. I'm a nursing student at Cedar Crest College, and today my talking poster is on the impact of nurse staffing levels on nurse level outcomes. This issue is significant to nursing because currently we are in a nursing shortage in the United States. 61% of nurses are employed in hospitals. However, the Bureau of Labor Statistics estimates that we'll need 649,100 nurses, which brings the total job openings for nurses to 1.09 million by the year 2024. It also should be noted that 75% of registered nurses feel that the shortage presents a major issue for quality of work life, quality of patient care, and it affects the amount of time that they can spend with their patients. Exploring the reasons behind the nursing shortage is critical to improve quality of care that nurses provide. My proposed PICO question for this study was, in registered nurses employed in the hospital setting, does adequate staffing compared to inadequate staffing improve job satisfaction, reduce nurse burnout, and impact nurse work environment? For the process of the literature search, I utilized the databases PubMed, EBSCOhost, and Ovid. My limitations were that the results included full text, peer-reviewed articles from the time frame of 2008 to 2018. My keywords included nurse, work stress, staffing, intent to leave, burnout, nurse work environment, and job satisfaction, as well as evidence-based practice. This yielded 170 results, from which I took 3 articles and rated them on their strength and quality of evidence, and then synthesized the 3 articles. The first article, selected by Fowler et al., had the purpose to examine the relationships of nurse attributes and hospital attributes to work-related burnout, job satisfaction, nurse-assessed quality of care, and intent to leave among travel nurses. This research design was a descriptive correlational study. The results found a higher correlation of burnout as the nurse-to-patient ratios increased. For my second article, selected by McHugh and Ma, they had the purpose of clarifying how wage, work environment, and staffing are associated with burnout, job satisfaction, and intent to leave. This study had a cross-sectional secondary analysis of a 2-stage sampling design. The results of this study found that good wages were important. However, interventions that improve the work environment and maintain reasonable staffing levels were more critical to attracting and retaining nurses in the hospital workforce. The third study chosen was a systematic review of literature from PubMed and CINAHL from the years of 2004 to 2012, with the purpose to identify the impact that ratios have on nursing workforce and work environment of nurses. The results from the 17 studies selected revealed that increased levels of nurse staffing resulted in greater job satisfaction. The ratios also resulted in more time with the patients, and there was more positive changes in the nurse work environment overall. Based on the findings from the synthesis of the evidence, the following recommendations were made. The first recommendation is to transform the organizational culture to create a more favorable work environment. The second recommendation is to continue the support of adequate staffing levels by hiring more nurses to handle the increasing workload. The third recommendation is to conduct further research to adequately explain the reasons for work-related burnout, job satisfaction, and how to best achieve high levels of quality of care in nursing. In conclusion, based on the evidence and the recommendations, it can be determined that adequate staffing is just one factor, however, a key factor impacting nurse level outcomes, such as job satisfaction, burnout, and work environment. Thank you for viewing my video. I look forward to hearing your feedback.